All right, CrossFit injuries. There's a bunch of injuries that can happen at CrossFit, but there's two main areas that I want to focus on. I want to focus on the shoulder and the back. So I want to kind of teach you just a little bit on how to maintain the health of your shoulder. So if we look at the stuff we do in CrossFit, we're doing a lot of pressing stuff, whether we're pressing up overhead, doing push-ups, hand release push-ups, or we're pulling overhead, doing pull-ups, kipping, toes to bar, and it's all those muscles that we're using are prone to pulling your shoulders towards the front like this. So your pecs are gonna, if you use your pecs in the front portion of your shoulders, they pull your shoulder towards the front. If you use your lats are this big muscle that come all the way down from your backside, and they attach on the front side of your shoulder. What they do, and if that's tight, it pulls your shoulder into internal rotation. So oftentimes I'll see a lot of CrossFitters for these injuries, and what they need to do is they need to kind of get back opened up. So they need to stretch out their pecs and stretch out their lats. Those are probably the two most important things to do. So your pec minor stretch, pec major stretch. Just kind of get in a doorway, get your elbows up in the doorway, step through the doorway, and you should feel a good stretch here, okay? Lat stretch, stay in the doorway, okay? Move up to one side of the doorway, grab the frame up overhead, and then lean your body away so you get a good stretch on that lat. Those are just two simple ways to help maintain the mobility of your shoulder, to reverse all the damage that's been happening as a result of all those pressing and pulling that you're doing. Now, oftentimes the back of your shoulder gets kind of weak also, so you need to do specific rotator cuff and scapular strengthening to kind of pull your scapulars back. We're helping it with the flexibility here to get it back, but we need to help it even more by strengthening up your scapular muscles to kind of hold you back. So that's just a little bit about your shoulders.